Is it just during pregnancy that these things can happen, or it can happen anytime in our life?
We have to differentiate a bit between the increased inflammation that happens during pregnancy due to those hormonal changes, which could be reversible, just inflammation.
Welcome back to Dr. Roze Biohealth Podcast. My name is Dr. Laura. I am a general practitioner, cosmetic and biological certified dentist in Dr. Roze Biohealth DIFC Clinic. I studied in Madrid, Spain at the Complutense University of Madrid and continued my studies in London to do advanced cosmetic dentistry, Invisalign and implantology. I am joined today with Dr. Manuel Carbajal, our specialist periodontist, who has recently joined us in Dubai after working for 11 years in the UK, both in the private sector and in the public healthcare sectors. He completed his undergraduate in Madrid, Spain, and furthered his studies in UCL in London to become a specialist periodontist. Today, we will be talking about periodontist and pregnancy. I know a little bit of this because I was pregnant 6 months ago, and he knows a lot because he's a specialist in periodontist and periodontology. So let's get started. Welcome, Dr. Manuel.
Thank you, Laura. Thank you very much for having me here today.
So tell us, Manuel, are you doing only periodontics, or do you do also implantology?
As a specialist periodontist, I focus obviously on everything that has to do with gum health. I'm treating all forms of periodontal disease as well, but as well sometimes we do have to replace some teeth that are lost due to gum disease or other reasons. So I do have specialized as well in implant dentistry. So those are my fields of expertise.
Very good. So tell us, what periodontal changes can happen during pregnancy?
Well, you might be familiar with some of them. Mm-hmm. Congratulations on your
thank you
for your little daughter. During pregnancy, there are many hormonal changes that go on. So there are increased levels of hormones, which can cause an impact in oral health. They do tend to make the gums more prone to inflammation. So that bleeding gums, swelling, some granuloma, gravidica can happen as well, as well as maybe some associated systemic problems that we have some evidence showing some relationship between adverse pregnant outcomes and periodontal disease. But we will expand on this.
Mm-hmm. So is it just during pregnancy that these things can happen, or it can happen anytime in our life?
We have to differentiate a bit between the increased inflammation that happens during pregnancy due to those hormonal changes, which could be reversible, just inflammation, or if not treated, or there is previous gum disease, periodontitis, and these hormonal changes can make it worse and worsen faster. Periodontal disease does not only happen, obviously, or gingivitis, which is gum inflammation. During pregnancy, it can happen in any patient that is susceptible. So not all patients are susceptible to the disease, but it can happen. So we'll focus a bit more today on the specific changes in pregnancy, because when we're thinking of what topic to talk about today, there are so many links with systemic health and periodontal disease that it's a bit too much to expand. So I think going one topic at a time.
Yes, definitely.
I will make more sense.
So after pregnancy, how long does it take for the gums to go back to normal, if they go back to normal?
They do. Go back to normal. It usually takes a few months. It varies on the grade of the level of inflammation that the patient is suffering, provided that it's reversible.
Mm-hmm.
So
is there any lasting side effects, like something that you can't revert?
You cannot revert the stages of periodontal disease itself. You can arrest the progression. So let's say that you start with inflammation, but if it continues and you start losing support of teeth.
So bone?
Yes, bone and soft tissues and gum, it starts receding. So that cannot be reversed. So we can arrest the progression of the disease, we can stop it, we can treat it, but we cannot get that support back.
Yeah, I understand. So is there anything that a pregnant woman can do to help to prevent this or to help when it started?
I think there is a lot the pregnant women can do, even, well, us as dentists, and I think we should work together with doctors, gynecologists, general dentists, specialist dentists, hygienists especially as well, in educating the patient on these symptoms. So first of all would be patients that are planning maybe, or women that are planning to get pregnant, knowing that dental checkups are important, assessing the condition of the gums, just even if it's at the beginning of pregnancy, just to know what's the situation and to keep that inflammation at bay, because there's going to be increased inflammation no matter what, no matter if there's very good gum health, no matter if there's no gingivitis, which is gum inflammation, things are going to happen, they're going to change. So first of all would be having a dental checkup, ideally, before or during the first stages of pregnancy, and then as well assessing for any symptoms, bleeding gums, discomfort, swelling, and more. In more advanced stages of the disease, you may start getting some bad breath, mobile teeth, anything that doesn't seem right. Probably it's because it's not.
Yeah, so, I know there's a lot of pregnant women that have been my patients that they don't know that they can have treatment when they're pregnant. So they don't even know that they can get cleanings, which I think is super important, especially during pregnancy. To have cleanings regularly. How often would you recommend the cleanings?
Yeah, I mean, absolutely. Sometimes we tend to believe that, well, pregnant women, we cannot really treat them until they give birth. And treating patients that are pregnant is actually very safe. It's very safe. We have to select what procedures we do, but having a cleaning can be done along the pregnancy. And if we need a bit more of cleaning, a bit more in depth, we tend to wait until the second trimester of pregnancy if they need some initial forms of gum disease, but they can have anesthetic. They could, if they need it, have some antibiotics. So they could have teeth extracted if needed. Sometimes it's needed and we cannot wait. So it is safe.
Definitely. And is there any supplements or vitamins that you think that could help with the gums?
Well, there are obviously, as a pregnant woman, I guess deficits. There are several deficits that you may suffer from. So obviously, having everything balanced and having the vitamins, having been checked with nutritionists or even your gynecologist, having everything leveled, it does have an impact because low vitamins can also have an impact on the gums, not only the general body and health, but having a balanced diet and having all the nutrients up to
so maybe
levels.
Getting a blood test and check if everything is on point.
Yes.
Yeah, I think also omega-3, for example, is a good thing for the gum health. It's a great anti-inflammatory. So I think omega-3s is something that you can take from your diet easily, eating walnuts or fatty fish, chia seeds. There's so many things, or even as a supplement you can take it. I think it's a good help, but definitely the main thing is always hygiene. It will always be hygiene, removing the bacteria from the mouth. So, so I think you were talking before about how the gums can affect the outcome of the pregnancy. How is this linked?
We do have evidence associating mainly some periodontal disease with what we call adverse pregnancy outcomes. That includes some like low weight at birth or preterm birth. That's before 37 weeks. And then preeclampsia, which is high blood pressure during pregnancy.
Yes.
So we know that there are some systemic changes going on, and then that can have an effect. The evidence is not strong in terms of having treatment during pregnancy can reduce the risk of these outcomes in every patient, but the evidence is pointing towards that we could actually intervene and potentially have a reduction of the risk of these outcomes in patients that are at a high risk of suffering these outcomes. That would be low socioeconomic status, or women that have had some previous preterm birth, or older women of higher age. So in these cases, we do know we can have an impact.
Yes.
There is a reason, what we think, some hypothesis that why we're not sure, we cannot see and demonstrate this effect. It might be because having treatment during pregnancy might be a bit too late to be able to reverse that. That's why prevention
is key, definitely.
It potentially will have a bigger impact than having treatment. Nevertheless, the periodontal status and health of women being treated is still going to improve, and inflammation is going to reduce. So that doesn't mean that they shouldn't be treated. There's still going to be a big benefit from it.
Very good. Yeah, I think every pregnant woman can benefit from this, because we all get a little bit of inflammation, and it's something so easy to go to the dentist, have a cleaning, improve your oral hygiene at home, and everyone can do it. So I think it was a really interesting podcast. Is there anything you would like to add?
No, it's just to finalize, I think we have to give some key details or some key messages, I would say, for pregnant women, just to finalize. We will focus mainly on the prevention, as we've said. I think prevention is the key. It's easy to overlook some inflammation. Yeah, it will go away when you give birth, but I think we need to act upon it.
Yeah, I think it's very important to get this message clear that bleeding gums are not normal. So every time that there's bleeding in the gums, there's something wrong. We have to do something about it.
Absolutely. Obviously, knowing the symptoms, as we've explained, would be helpful, just to seek advice, to seek help if needed. And then, awareness about the periodontitis, periodontal disease, and the potential systemic involved systemic problems it may have. The links that we've are shown. It's not only during pregnancy, so we do have some other links associating periodontal disease with other systemic diseases. So that comes to show the importance of an overall health and oral health as well. So I think that would be the key message for.
Yeah, very good. So thank you, Dr. Manuel. That was a really interesting podcast. And thank you everyone for listening, and see you on the next one.